So every March, we observe World Glaucoma Week. But what is glaucoma, and why do we need to observe World Glaucoma Week every year? So hello everyone, I'm Audrey and welcome to another Ask Your Asian Eye Doctor Facebook Live session. Joining us today, this is Asian Eye Glaucoma Specialist Dr. Imelda Yap-Veloso. So Dr. Veloso is one of the directors of Asian Eye's Glaucoma Service. She finished her medical degree and residency training in ophthalmology at the UP College of Medicine at the Philippine General Hospital. Then she completed her fellowship training for glaucoma at the Harvard Medical School under world-renowned Dr. Richard J. Simmons. She followed that up with a postdoctoral research fellowship at the Harvard Medical School Shepard's Eye Research Institute. And she's since conducted various research projects and has given numerous lectures on eye disease and surgery, both locally and internationally. I think what's interesting, Doc, with you in particular, and the fact that we're doing this March, is that it's also International Women's Month. And siguro if we were talking about women who are kind of doing their own thing and kind of being an innovator in your own field, it's important for viewers to know that you as a doctor, you've also served as a past president of the Philippine Glaucoma Society. You're a member of the Board of Trustees of the Philippine Glaucoma Foundation. You've also served as a clinical associate professor at UP College of Medicine. And you've served as the vice chairman and head of the training committee of the Department of Ophthalmology, and you serve as the chief of the glaucoma service at Rizal Medical Center. So the way it sounds, Doc, you actually have quite a lot of things on your plate. And a lot of these things are really related to being able to specialize in glaucoma and being able to help a lot of people understand the disease and also how to treat it. Because I think with a lot of people, they're worried that when they're told na meron silang sakit sa mata, there's nothing that they can do about it, and they're just kind of gonna have to suffer through it, or ganun lang talaga kasama ng pagtanda. So Doc, good afternoon and thank you for spending your afternoon with us.
Yeah, good afternoon, Audrey. It's an honor and pleasure to be here.
Okay, and then so first things first, Doc. So what is glaucoma and what does it do to your eye?
Yeah, so glaucoma, Audrey, is a group of eye diseases na the main problem is yung pag-akyat ng presyon sa loob ng mata, or what we call the intraocular pressure. This increase in the intraocular pressure inside the eye damages the optic nerve. And the optic nerve is a very important structure because it connects the eyeball and the brain. So lahat ng kapinsalaan na mangyayari sa optic nerve is permanent. And if glaucoma is not controlled, it can lead to blindness. So that's practically what glaucoma is. The pressure goes up, it damages the nerve, and it slowly destroys the vision starting from the periphery until blindness ensues if it's not controlled.
Okay, and the reason why we celebrate World Glaucoma Week, why do you think it's important that we do that?
Yes, because actually, Audrey, World Glaucoma Week is a project of World Glaucoma Association. And the World Glaucoma Association is a group of the different glaucoma societies all around the world. And the main goal of World Glaucoma Week is to make the general public aware of what glaucoma is, what it can do to our vision, and how can we avoid the damage that comes with glaucoma. So that's actually the main role of World Glaucoma Week. And I'd like to encourage our viewers. The World Glaucoma Week is from March 7 to 13, so it's still ongoing. If you have a hospital or eye center near your place, you just call. They may be offering certain glaucoma screening packages and also lectures that may help you understand what glaucoma really is.
Okay, and then siguro related to that, you've said that it's a very serious condition and it can lead to blindness. Is that why tinatawag siya sneak thief of vision? So if we were to translate that into Filipino, literally, it's magnanakaw ng paningin. So is that why, Doc, parang usually kapag di ka nagpa-check, bigla na lang mangyayari na pwede ka palang mabulag?
Yes, kasi Audrey, that's very true because glaucoma, as we mentioned, it affects the optic nerve, and if the optic nerve is damaged, the first thing that actually is affected is your peripheral vision. So in short, you can have 20/20 vision very good vision centrally, but you may already have moderate to advanced glaucoma. So you really don't just base it on what you can see centrally. And because glaucoma slowly destroys peripheral vision without us knowing until you sort of notice that you are losing vision when you bump into garbage cans, when you lose your inferior field of vision, or when you're driving, you don't see cars that cut you from the side, and suddenly you realize your vision is limited. Then that's only when you recognize that something is wrong with your vision, and usually that's already late in the disease process. Now, as we mentioned early on, there are no symptoms. That is why glaucoma is labeled the sneak thief of vision. Yeah.
Okay. And then with that, Doc, kasi for me, when you said na minsan, yun yung dahilan why some people, they trip over yung mga garbage can kasi it's usually to the side and na mababa. So kapag yung
That's
peripheral
correct. Yeah.
kasi yung affected, that means malinaw yung gitna. So if face-to-face tayo, malinaw yon. Pero
Mhm.
if say someone were to put something down near my feet, I'm gonna miss that, you know. Or
Yes.
if I'm driving,
Yeah.
magagat
So,
na talaga
Audrey,
yung car ko.
yeah, that's correct. Kasi glaucoma, you don't think it's just from the side here, no? As
Mhm.
Audrey mentioned, you can bump into the garbage can because even your lower field of vision can be affected. Also the upper field, no? So it's all around. Yeah. So that's what it does in the initial stage of the disease. And the
Mhm.
central vision, Audrey, is always the last to go. That's why it's a late diagnosis if you just rely on the patient's symptoms.
Okay. And then, Doc, that's why doon rin nagagaling sinasabi nilang tunnel vision. Kasi pwedeng wala yung taas at saka yung baba, pwedeng wala yung left and right. So it
Oh,
could
that's
be
correct. Yeah.
different for each person. Okay.
Yes.
And then, Doc, so how would I know kung what causes it, and ano ba yung risk factor ko for developing this disease?
Okay, let me talk first about what happens normally, Audrey, inside the eye. Inside our eye, the eye makes fluid, or what we call aqueous humor. It's like the water inside the eye every minute. And every minute, there is also a batch of water that should drain out of the eye because a new batch is made every minute. So the volume inside the eye at one time is always normal and just right. Now,
Mhm.
what happens in glaucoma, the drainage system is defective. So the eye produces the water every minute, but it cannot anymore exit at the same rate it's being made. So the water accumulates inside the eye. There's a lot of
Mhm.
residual fluid, and the pressure starts to go up. Now, this increase in pressure, as we mentioned, is the one that damages the optic nerve. And as Audrey has already asked, what are the risk factors, no, that can put you in that group that you're more likely to get glaucoma? No, the first is still age.
Okay.
Um, Patients that are 40 years old and up are more at risk. A patient with a family history as well. If you are nearsighted or farsighted, your risk is also a little more. There are also eye conditions like if you had a trauma or accident
Mhm.
affecting your eye, or certain eye diseases like uveitis or diseases of the retina can sometimes also put you at a higher risk for glaucoma. Also, if you had surgery in the past, sometimes that can be a risk factor too. The use of certain medications, Audrey, like steroids,
Mhm.
we use steroids for, let's say you have a sore eyes, you have sore eye, sorry, and your doctor gives you an eye drop. Sometimes there may be a steroid component here. So you have to be careful because it's really a wonder drug. It removes the redness. Also for
Uh-huh.
allergies, steroids are used. So sometimes you just keep self-medicating, Audrey, and then not knowing that you may be developing a certain form of glaucoma called steroid-induced glaucoma. Yeah, so you have to be
Oh,
careful with that. Yeah.
okay.
See?
So I think that's an important tip kasi lalo na ngayon that it's pandemic, I'm sure a lot of people are kind of avoiding going to the doctor. So let's
That's
say
correct.
mag-develop sila ng some sort of eye irritation, they feel like yung pakiramdam nun, parang yung sakit ko dati, automatic, ay hindi, bulin ko na rin gamot. Di na ako
Yes.
lalabas, di na ako
Yeah,
magpapacheck,
actually,
I'll just
or
use the
diba,
drop.
like it could also be like your friends tell you, ay, this one's so good, it will remove the redness right away. But yun nga, be careful because you're not sure what the component of that medication is. And long-term use, more than 2 weeks, put you at risk already for a steroid-induced glaucoma. And then also, Audrey, may I just emphasize, it's not just eye drops that have steroids. We know that steroids are used for other problems like asthma, autoimmune diseases, even some athletes, sometimes they use steroids. So
Yes.
given in other forms, you can still put yourself at risk for glaucoma. Yeah.
Oh, I remember, Doc, even some mga creams, yung mga topical creams also have
Oh, that's
steroids.
correct. Yes.
Can that also affect? That's
Yes,
another.
especially if it's used near the eye, yeah,
Okay.
and in long periods, yeah, long periods and large quantities, yeah.
Siguro that's important for the people watching us today, na kapag sinabi sa'yo to use steroids, never more than 2 weeks at a time,
Yes,
right?
or better, you just it comes from a doctor when it's a steroidal medication because we also so Audrey had cases just a week on steroids but high dose and they can still
Mhm.
develop glaucoma. So just be careful. It's better if it came from a doctor when you're on steroid medications.
Okay, okay. And then, so normally, iniisip natin something like glaucoma, sa katandaan yan, it comes with age. But in fact, meron ka mga pwedeng gawin that can induce it. You're more likely to develop it. And like for
Yes.
me, siguro important that when they realize that if you get any injury sa mata, right? You get poked, something gets trapped in your eye, or let's say you get punched, right?
Yes, that's correct.
Those
Yeah,
are
it's
all
better to have a
things that can
check-up, a
actually do
thorough
it.
check. Yeah. So you can make sure that you did not develop certain changes in your drainage canal that can make you at a higher risk for developing glaucoma later on in life.
Okay. So yun, when it comes to glaucoma, it's the drainage system of your eye na nagkaroon ng problema. So with any bara, right? So para siyang bara,
Oo.
Doc, kasi dapat
Parang lang,
nagde-drain siya.
parang yeah, yung plumbing problem yung glaucoma. You can't seem to drain out the water. Remember, the eye will always produce that fluid every minute, regardless of whether it's able to exit or not. That's the reason why the pressure can go up when the
Okay.
drainage system is faulty.
Okay. And then, Doc, you mentioned that there are really different kinds of different types of glaucoma. So what are these different types?
Yeah, actually, Audrey, you can divide glaucoma several ways. So, if your basis is yung, let's say, yung age, kung saan nag-start yung glaucoma or kung saan kailan nagsimula, you can divide glaucoma into congenital glaucoma,
Mhm.
juvenile glaucoma, and adult onset glaucoma. Now, let me talk a little about it. Congenital glaucoma presents in the first 3 years of life. And usually, dahil yung tissue ng isang sanggol, no, or baby, is still very pliable or elastic. When the pressure goes up, the eyeball stretches. So these are the patients that present with large eyeballs, tearing, and blurred vision. So those are like the warning signs that the patient or the baby may have glaucoma. Now, developmental glaucoma is usually older than 3 years of age, and your adult onset, which is probably 90% of the glaucomas we see, are 40 years and up. Now, Audrey, if you divide it based on the type of drainage problem, you can divide it into two main types. Open angle, where the drainage system is open, but you would ask, why is there a problem if the drainage canal is open in open angle glaucoma? It's because even though it's open, the drainage system is not anymore working or functioning effectively. So it's not able to push out the water regardless of the open channels in your drainage system. So it's already faulty. Now, this is in contrast to angle closure glaucoma, where your drainage system is really structurally closed or nakabara talaga. So there's really nowhere structurally where the water can drain out. This angle closure glaucoma is more common in the Asian population, and it is also more aggressive than the open angle type of glaucoma.
Okay. And then, Doc, kasi you said that in Asians, mas likely yung angle closure. It's because, like, if you look at someone na Asian, medyo yung mga chinita-chinita, your eyes are naturally a little bit slanted or smaller. So
Yes,
does that
usually
have
because
something to do
that's
with it?
correct, because the eyeball of a Caucasian is usually larger than the Asian eye. Although there's a lot of open angle glaucoma also that we see in Asian eyes. If you look at the distribution in the world of where the most angle closure glaucoma patients are, they're going to be in the Asian region because of
Okay.
that. Yeah.
Okay. So at least alam natin na if you're living in Asia, you grew up here, you have Asian features, mas likely ka to develop that type of glaucoma. So if let's say isa akong person and I find out na meron akong history with my family na meron ng posibleng nabulag or someone had some vision loss related to glaucoma. And then I know that my features, specifically yung structure ng mata ko, medyo likely, it's a good
Like if
idea.
you're farsighted, Audrey, kasi the farsighted, again, they have smaller eyeballs or shorter eyeballs. So they may be prone more to the angle closure type of glaucoma compared to like the nearsighted, Audrey, that they have large or elongated eyeballs. Usually they're more prone to the open angle than the angle closure because nga the shorter eyeballs, it's mas masikip eh. So mas malaki yung risk ng angle closure glaucoma.
So, kumbaga, meron talagang genetic factor when it comes to developing this condition. Kasi nataon, when you were born, gano'n na talaga yung mata mo. So, in your family, you're more likely to develop it. So, if you're aware, mas maganda na talaga ipa-check. And then, Doc, you said that most of the time, wala namang symptoms at the start when it's developing. So, how do you know you have glaucoma? Are there things na siguro kapag medyo moderate na yung glaucoma ko, I'm gonna start noticing certain symptoms?
Yes, if you're in the open angle type of glaucoma, Audrey, this is the one the eye slowly adjusts to the gradual increase in the pressure of the eye. So usually there's no pain. And as we mentioned earlier, you usually notice the symptoms of loss of vision in the peripheral field in the moderate to advanced stages already. But there is a subtype, Audrey. It's called the acute angle closure glaucoma. This type presents with symptoms. In this type of glaucoma, the drainage canal suddenly closes and the eye cannot adjust to this sudden increase in eye pressure. So there's going to be eye pain, blurred vision, you'll feel nauseated, you'll also be vomiting, headache in that same side. When you look at the light, there can be like rainbows. It's called iridescent vision or halos. That means the pressure in your eye can be higher than the usual. So this particular type of glaucoma presents with symptoms, and you should go to the emergency room if you have these symptoms or see your doctor right away.
Okay, from the sound of it, Doc, acute kasi it's sudden. It's a sudden onset. So, para sa mga nanonood sa atin, it's important na kapag ang naramdaman niya is parang masakit yung mata, may sakit ng ulo pa, kapag tumingin ka sa ilaw, parang may halo.
Yeah, or rainbow, yeah. Yes, that's correct.
Parang either may halo or parang rainbow siya. Pa-check mo na agad. Kumbaga, wag mong hintayin, wag mong isipan
correct,
that you can wait it out kasi it could actually be acute angle closure glaucoma.
That's correct, yeah.
And then, in that case, though, kapag acute siya, if it closes suddenly, it needs to get checked right away kasi can that immediately lead to some sort of vision loss?
Yeah, usually kasi, Audrey, when it's a sudden closure, the eye pressure escalates to a level that's it's really, it can be more than 50. The normal is usually 10 to 20, and it can go up as high as that. So it can really cause permanent loss of vision. This is an emergency, actually, when this happens.
Okay.
Yeah.
Okay, so ganon, kailangan na ipa-check agad.
Emergency room, yeah, or you call your doctor if you have an eye doctor, or go to an eye center right away.
Okay. And then, Doc, when it comes to the test, kasi syempre gusto natin malaman, gusto natin ma-detect yung glaucoma.
Yes.
What are the tests that they undergo?
Yeah. Audrey, in a complete eye examination done by an ophthalmologist, you will be able to tell whether a patient is at risk for glaucoma. So what are the warning signs in your eye examination? So for us ophthalmologists, the warning signs are: number one, if the pressure is elevated, so that puts you at a higher risk. Number two, if the optic nerve changes its color and form. Normally, the optic nerve is reddish-orange in color, and there's very little paleness in the center of the optic nerve. If the paleness, or what we call the cup, increases in size, then you are at risk for glaucoma as well. And the third is your drainage canal. That's why it is important to always try to check the drainage canal of a patient in a complete eye exam. If the drainage canal is narrowing down or it's closing, then that patient is at risk for glaucoma. Now, if this or any of these signs are positive, you will have to undergo additional testing. And this additional testing usually consists of visual field, where we objectively measure how much the patient can see, either superiorly or in the side and in the lower portion of the vision. And now, if you have a narrowing canal, there's also a scan that can be done, that can objectively confirm whether something has to be done to protect you from your canal from going into angle closure. And then the third is also another scan, this time of the optic nerve, because remember, the main structure that is destroyed in glaucoma is the optic nerve. So as it is destroyed, the optic nerve, Audrey, thins out, numinipis siya. So the scan of the optic nerve, or what we call the OCT, it's like a CT scan, measures how thick your nerve tissue is. When you have glaucoma, you lose tissue, so it thins out. So this will help us diagnose glaucoma at its earliest form. So these are the additional tests that are needed if you are positive for any of those warning signs that we mentioned: the increase in pressure, the change in the optic nerve appearance, and the drainage system narrowing or closing down.
Okay. So with those, Doc, kasi it's a series of tests, di ba? So the goal is parang kina-correlate natin yung mga results of each of those tests to talagang confirm kung glaucoma ba talaga yung na-experience mo. Siguro one thing that maybe people are worried about is, masakit ba to undergo the testing? Or
No.
is it...
Yeah, there's no pain naman, Audrey. Of course, when you check the pressure, you see the instrument coming close to your eye, but there's no pain. Don't worry about it. It's a painless examination, for all.
And then, siguro kasi natin na maraming mga other, let's say, kung bibili ka ng salamin, minsan sinasabi nila, uy, we're gonna get a complete eye exam, don't worry, you get your glasses at the same time. Ang level ba ng check-up ng tao na gustong magpasalamin is the same as a complete eye exam that would be able to help you detect if merong problema sa mata like glaucoma?
In Asian eye naman, even though you come, let's say, I would encourage everyone though, Audrey, to come not just for an eyeglasses check. Kasi sometimes some people, di ba, if the eyeglasses corrects their problem, they can see
Okay na,
20/20, okay na . Pero you will miss out on certain diseases of the eye. You can miss out on retina problems. And one thing you're surely going to miss if you have it in the early stage will be glaucoma. Because as I said, no symptoms, and your optometrist or the optical shop or the glasses will be able to correct you to 20/20. But you may have already glaucoma and not know it.
Okay, so yun, kailangan doon siguro maging maingat yung mga tao na kapag sinabi nating magpa-check ng mata for glaucoma, it means coming to an ophthalmologist kasi magkaiba yung testing at iba yung hinahanap nila versus someone na, sige, gusto ko lang pasalamin, malinaw ba yung mata ko? Kasi as you said, pwede kang may 20/20, pero nami-miss mo na pala, meron na palang vision loss sa side or sa top or sa bottom. Sayang naman kung hindi natin makatch na maaga.
Yeah, that's correct.
And then, siguro, you mentioned, Doc, since it is World Glaucoma Week, is that meron rin naman tayong glaucoma screening promo. So for those people who are worried, yung sinasabi natin sa risk factors na baka meron kang family history of it, or na-injure ka na sa mata, or you are farsighted or nearsighted, or maybe you've been injured before, we do have a promo that will make it easier. Para kung iniisip-isip pa, magpapacheck ba ako? Hindi. We'll try to make it easier for you. You just visit www.asianeyeshop.com, and then you click on our e-gift certificates and just add glaucoma screening, the gift check to your cart, and you'll get 25% off on the screening itself. And you can use that sa mga Asian Eye Institute clinics. So at least yun, if they want to meet you, Doc, they want to consult with you, that's something that you can use.
Yeah, but keep in mind that, of course, we don't do it in all patients. Only in patients that have warning signs that they may have glaucoma. But yes, there's now glaucoma screening packages, especially now that it's World Glaucoma Week, that you can avail of.
Siguro, lalo na for the people na baka nasabihan na ng doctor nila before, pero nag-hesitate pa sila. So this is a good
That's
time.
Correct. That's correct, yes.
Oo, kasi sayang naman. It's a good time to do it. Lalo na, yes, of course, there is a pandemic, mag-iingat tayo. But we want to make sure na people get checked, na yung mga tao na nangangailangan talaga, they have the opportunity to get the check that they need. And then, Doc, we've talked about the symptoms, we've talked about the risk factors. Paano ba yung treatment? Can glaucoma be cured?
Okay, actually, that's a very important point, Audrey, because we have to keep in mind that this disease, unlike other diseases, it's a lifelong disease. It's never cured. It can only be controlled. And everything you lose from glaucoma is permanent. That's why important yung sinabi mo na you have to be ahead of it. You have to try to, like, maski 2020 ka, you might miss it, sayang. Sayang talaga kasi hindi mo mababalik yung nawala sa'yo with glaucoma. Yeah, you have to be ahead of it. Now, in terms of managing glaucoma, no, we follow, Audrey, a stepwise approach. We usually start with conservative treatment. So, the first line, the first step is medications. And actually, lucky tayo na yun, Audrey, kasi if you're going to go back in time, no, 30 years ago, our parents probably only had one or two classes of glaucoma medications available, no, to treat their glaucoma. Now we have 6 glaucoma medications, eye drops available to treat glaucoma, and you can use this as a single treatment or in combination with each other to reach that target level of pressure you need. Now, in the Philippines, though, we don't have all the 6 classes, but we have 5 of the 6, which is good enough. Now, if, Audrey, the drops or the medications, usually kasi eye drops yan, no, yung medical treatment, it's not usually oral. If the eye drops are not enough, then we go to laser treatment. Now, in laser treatment, it depends what kind of glaucoma you have based on your drainage system. If your drainage canal is narrowing or closing, it's going to be what we call a laser iridectomy, where we put a bypass canal. So it changes the course of the closure of your eye canal over time. If it's open angle, meaning bukas naman yung canal, pero hindi pa rin kaya ng gamot to control the pressure, we do selective laser trabeculoplasty, where we laser the drainage system so to open the channels more so the water can drain out more. And if medications and laser treatment are not enough to control the glaucoma, then we move on to glaucoma surgery. Now, glaucoma surgery, we try to reserve it for last when you don't respond to medications or laser. And in glaucoma surgery, let me just talk to you about the gold standard we do. No? The gold standard is trabeculectomy, where we make a more definite connection between the inside of the eye and the outside of the eye. So we create like a drainage system that forms a reservoir on the upper portion of the white part of the eye. So the water drains out constantly and keeps the pressure down.
Okay. So for me, Doc, can you explain yung it's trabeculectomy, Doc, no? Yung creating that
Yes.
another canal. So
Yes.
it's a reservoir just to make sure na kasi nung pinag-uusapan mo, Doc, na it's kind of like having a plumbing problem sa mata. Yung parang may problema sa tubo ng mata mo, kaya hindi siya nagde-drain. So what you're doing with the trabeculectomy, kumbaga para gumagawa ka ng bypass canal.
Sige, yes, correct, Audrey.
So i-move natin somewhere else para at least mawala yung issue na nagbabara siya. So, important din na na-realize sa mga tao na kapag sinabing glaucoma, hindi naman surgery agad. Yun yata kasing takot.
As much as possible, Audrey, we will try the conservative measures first, to make sure parang we are really in need of the surgery if we do recommend it for you.
Okay. And then, Doc, once na-identify na that you do have glaucoma and what kind of treatment that you need, matagal ba yung gamutan nito? Ibig sabihin ba nito, buwan-buwan nasa clinic ako? Or how does it usually work for that?
Yeah, actually it works this way, Audrey. Depending on the stage of glaucoma you have, like if you're in the early stage and you're controlled na naman ng gamot mo, no? The medications are doing very well for you. And as I said, early stage lang, every 6 months will be enough. Your doctor will tell you. Now, if we see that it's going up, then we may tell you to come back sooner. But usually, pag moderate to advanced stage, Audrey, we see the patients more often. Like probably 3 or 4 months, advanced cases siguro. Sometimes my patients, just to make sure na secure talaga sila kasi they're already in the advanced stage or mga one-eyed cases na lang, the other eye is already blind from glaucoma, I see them as often as every 2 months. Yeah.
Okay. So it really depends. Kaya
it really depends, yes.
Get it early so that more or less parang maintenance drops siya.
Oo, yes.
When you say, Doc, na let's say it's early on, you find out na meron siya talagang risk for glaucoma and you want to treat it. When you say na meron siyang drops na kailangan ipatak, ibig sabihin ba nito everyday may pinapatak or is it
Oo,
something?
everyday, Audrey. The drops from glaucoma medications, what I do nga, I put na lang the time para hindi sila guided na sila na at this, kasi sometimes if you leave it up to the patient, nakakalimutan nila kasi anytime they think they can put it. I really put a time schedule so they can comply more. So I'm certain that the medication is really given at a specified period of time. Remember, your eye drops don't work forever. There's a limit. That's why when we tell you 3 times a day, it has to be 3 times a day. When it's twice a day, that means your eye drops only work for 12 hours. So you have to do the 2 times a day if it's, or every 12 hours when we tell you 2 times a day.
So, dyan po pasok, Doc, yung importance of being or following the doctor's prescription. Kasi hindi naman tayo nag-guess about when you need to
Yes.
put drops.
Yes.
There's a reason for it. And then, Doc, siguro, there are a lot of things that people say about glaucoma that may or may not be true. So let's talk about yung iba mga myths about glaucoma. So the first, this is something that I think is quite popular. Can marijuana be used to treat glaucoma?
Actually, many people were advocating the use of marijuana. These are non-medical personnel because few studies show that the pressure went down when marijuana is given as an inhalational, oral, or IV treatment. The problem is, Audrey, the studies also showed it only went down for a while. So that means you have to take it several times a day. And of course, since glaucoma is a lifelong disease, you're going to have to take it every day. And because there are other forms of treatment, like, as you mentioned to you, eye drops that are effective and relatively safe, as well as laser. We don't actually advise that. And the American Academy has already come up with a statement on that, that using marijuana to treat glaucoma is not at all recommended. So it's not to be used for this purpose. Yeah.
So I suppose,
I'm glad you brought that up because I still get questions about marijuana and glaucoma in patients because of what they hear and read. Yeah.
Yeah. Kasi syempre the idea of having medicinal marijuana is very interesting and attractive, lalo na for people na siguro naririnig nila from abroad.
Especially Audrey, when it became legal to use it for medicinal purposes in California. So parang a lot of relatives of patients here were saying, so at least now it's already more, well, the American Academy has been more public about their statements on marijuana.
Kasi at least kapag yung medical eye drops talagang ginagamit, sure ka.
Sure ka, and it's proven to be effective.
Proven. So, as attractive as yung parang mga fads na ito, let's go with what works. Let's go with what's been approved also.
That's
and then,
correct.
How about, syempre marami tayong naririnig din about the wonders and the benefits of taking red wine. Is that also something that could help something like glaucoma?
Yeah, actually in the past, Audrey, there were a few studies that came out also that drinking red wine can bring down the pressure. But just like marijuana, it's only for a limited period of time. And it was also shown in other studies that if you drink too much, like in chronic alcoholism, it can raise the pressure. So because of that, always take it in moderation, but don't rely on red wine to treat your glaucoma. But it's not naman na it doesn't bring it down. It's more of you'll have to take a lot also to help you control the glaucoma if you're going to use that. So you really have to stick to what's proven safe and effective.
Kasi kung sinasabi natin yung eye drops, tinitake mo yan every couple of hours, every day. The idea of taking wine every couple of hours to generate the effect, parang mahirap na. Lalo na if you're working, to always have a glass of wine there. It's hard to explain. And less reliable.
That's correct. Yes.
Okay. And then how about, Doc, when it comes to any activity? So let's say I have been diagnosed with glaucoma. Are there things I have to avoid, like with other conditions sa katawan?
Yes. Actually, I know a lot of people are into yoga, and that's a good form of exercise and relaxation. The problem with yoga is it already has been shown that certain positions in yoga increases the pressure of the eye significantly. So if you have glaucoma, it is best to mention this to your glaucoma specialist or ophthalmologist because there are, as we mentioned, certain positions like these are the headstands that can increase eye pressure to as high as 10 points higher than your baseline pressures. And also certain positions like your downward facing dog, positions that put your head lower than your heart usually are the positions that can cause an increase in the pressure inside the eye.
Okay.
So just do this with caution when you have glaucoma, or confer with your ophthalmologist about this. Yeah.
Okay.
If you're active in this type of activities.
So siguro it's good na, let's say when you're a patient, kapag binivisit mo yung doctor mo and they ask you how you are, it's good to actually tell them about,
Yeah, that
yes,
you do
Doc, this
it.
is what I'm
Yeah.
doing for
Do you do
exercise.
yoga, Audrey? No.
I
Do you do
have, I
yoga?
actually have. Sinisip
Wow,
ko,
okay.
kailangan hindi, you have to keep it in mind. Doc,
Yeah.
if it's a person with glaucoma, and let's say medyo prone na siya to yung high eye pressure, is that something a yoga practitioner might feel? Like, do you think they'll feel habang nasa position yun? Parang medyo,
Yeah, kasi the pressure kasi you can still feel it even though your pressure's not up because of the pressure of like by gravity, when you put your head down.
yes,
But
that's
you
right.
might not be able to tell if it's going up. Yeah, that's why for me, maybe if you have an early type of glaucoma and controlled very well and you're given a go signal, that's why it's better to confer with your ophthalmologist. If it's early glaucoma, controlled very well with the eye drops, and you probably just do just a few minutes of this like every 2 weeks, it might not really hurt. But if you're in the advanced stage and you do a lot of this like twice or 3 times a week, it may be better to avoid these positions in yoga altogether.
Yes, and it's good rin naman with a lot of these exercise forms is that pwede naman silang ma-modify. Na just
Yes.
because, let's say,
Yes,
standard practice, kasama siya, you
that's
can
correct.
of course
Yeah.
customize it for yourself depending
Yes.
on what's healthy for you. And then, Doc, ito, siguro I'm also looking at some of the questions and I've noticed a lot of people have parang questions that have to do with both cataract and glaucoma. Kung anong difference nila or what
Okay,
happens
yes.
when you have both.
Okay.
Ganon.
There are 4 points kung saan nag-iiba yung cataract and glaucoma, no? So the first point is yung bahagi ng mata or the part of the eye that's affected. In cataract, it is the lens of the eye. So normally you have a clear crystalline lens, no? Para kang looking through a glass window that's clean. That's your lens. It's very clean and clear. Now, when the lens becomes cloudy because of age or smoky or fuzzy, then that's already the start of a cataract. This is in contrast to glaucoma, where the part affected or yung bahagi ng mata na apektuhan sa glaucoma ay yung optic nerve, which is the main structure nga that connects the eye and the brain. No? Now, the second difference, Audrey, is the symptoms. In cataract, the symptoms are gradual, progressive blurring of vision. That's usually described, as you mentioned earlier, as smoky and cloudy. As I said, it's like looking through a glass that's frosted or cloudy. Yeah. So now, glaucoma, as you mentioned, most of the time, no, walang symptoms. Kasi nga yung peripheral vision yung unang nawawala. So later on mo na lang nalalaman na tunnel vision ka na pala, advanced stage ka na. Now, yung third difference is yung cataract, it's a temporary loss of vision. So pansamantala lamang. Pag tinanggal mo, babalik sa dating paningin mo. Which is in contrast to glaucoma, na lahat ng mawawala sa'yo from glaucoma, we cannot bring it back. That's the reason why it has to be early diagnosis. So it's a permanent loss of vision in glaucoma. And then the fourth difference is the management. As you mentioned earlier, yung cataract, you take it out, you replace it with a artificial intraocular lens, nakakakita ulit yung patient. So that's done na. Wala na siyang cataract. Kasi tanggal na eh. May implant na siya eh. Yung glaucoma, lifelong disease, it's never cured. You can just control it. Yeah, so that's the 4 major difference between a cataract and glaucoma.
Okay. So again, those are really important points kasi siguro kapag sinasabi ng mga tao, ay may problema ako sa mata, iniisip nila pare-pareho lang yan and all of them might be age-related lang. Tumatandaan na tayo, baka siguro apektado na yung vision. So it's good to remember, magkaiba sila, magkaiba yung experience mo at magkaiba rin yung treatment for it.
That's correct.
So siguro, Doc, we probably have a lot of patients that during this pandemic, baka worried din sila about getting checked, about consulting inside the clinic. Pwede bang ma-check ang glaucoma or mag-consult tungkol sa glaucoma through teleconsultation?
Actually, the problem lang kasi in glaucoma is we have to check certain things, no? But teleconsult still plays a role because I have had some of my patients from the provinces that because of lockdowns were not able to come in. And of course, we can advise you kasi in the teleconsultation whether your symptoms or the changes you experience will need a face-to-face consult right away. So it's still important. If you can't make it for a face-to-face, I still urge you to go for a teleconsult because at least we will be able to advise you some emergency remedies that can be done until you are seen by a glaucoma specialist or an ophthalmologist.
I think that's particularly important kasi next week, nabalitaan na natin that for Metro Manila, there's gonna be a curfew from like 10 p.m. to
Okay.
5 a.m.
Yeah,
So baka people na galing probinsya,
that's
depende
correct.
sa
Yeah.
oras ng pag-travel nila,
Oo.
iisipin
Yeah.
nila, mahirap masyado to go to Metro Manila para magpa-check. So at least option natin na magpa-teleconsult, available si doktora, and lalo na siguro for patients na narinig ko ito madalas, sinasabi nila na kapag nakita ko ng doctor ko, I feel a lot better. If I'm able to talk to my doctor, somehow, even through a video call, it gives them
Yes,
peace
that's
of mind.
true. It's true. And yun nga, para at least we can advise you, yeah, what to do, yeah, from that point on.
Okay. And then siguro, Doc, I'm seeing a lot of the questions from our viewers now, so I will run through a few of them. So the
Yes.
first from Ms. Paz Acero. If your eye pressure is always above normal, does this indicate that you have glaucoma?
You may be just a glaucoma suspect kasi like this, no? It's not just the pressure that you look at. So you have to look at the other factors in the eye like the optic nerve and your visual field and your drainage canal. There are some group of patients that are called ocular hypertensives that are a little higher than the normal, konti lang, or on the borderline. But when you do your tests, they're all normal. This may be some of the patients that you can observe without medications. But yun nga, it's hard to answer that question unless all these
Nakita na.
important findings are known. And if you need additional tests, we also know the results before we can tell you if we can just observe you or we need to put you on medication if you're out of the normal range of pressures.
Okay, so siguro for someone that might have that concern, get checked at least annually para ma-monitor all these factors that could lead to glaucoma. So at least kapag normal pa, babantayan lang natin. Kapag hindi, then let's do something about it. And then, Doc, next question is from RC. Can any ophtha diagnose and treat glaucoma, or is there a special field of study?
No, I think as long as the ophthalmologist does a complete eye exam, he will be able or she will be able to tell you whether you're at risk. And from that point, additional tests will be needed. And whether you need a glaucoma specialist, the general ophthalmologist can also make that call.
Okay, so at least marirecommend yan. Sige, I'm seeing that this looks like it's glaucoma. You can be referred to a specialist for specific
Yes.
treatment. Na.
That's correct.
And then from Christina Andrade, if regular I'd like to ask if regular eye checkup is needed. As of now, I have eye drops. So baka nga, this patient sounds like they might have
Eye
been
drops for
diagnosed.
glaucoma. I'm assuming it's eye drops for glaucoma,
I
Audrey.
think so, Doc.
Yeah, if you're, kasi, okay, can I just emphasize, that's an important point. It's a good question, because you think when you're given glaucoma, let's say you have glaucoma and your doctor says, oh, this eye drop is for life, more or less, so you use it regularly. That doesn't mean that you should not anymore see your doctor. I'm sure your doctor will tell you to come back for follow-up because over time, the medication may not work as well. They may have to change your medication or add more, no, to reach the safe pressure levels you need to reach to keep you protected from further progression of the glaucoma. So it is not enough to just put the drops in. You have to see your doctor regularly who will tell you if you are controlled and your glaucoma is stable or not.
And kanina, Doc, binention nyo kasi that there are 6 classes of glaucoma medication and 5 of the 6 are available in the Philippines. So as time passes, alam naman natin na nagbabago yung technology, nagbabago yung treatment methods.
Yes, that's correct.
So if you just take drops and you just replenish it every month, you don't talk to your doctor, hindi mo malalaman na meron palang alternatives. Baka it could be you're gonna change your drops or different
different treatment na hindi na pala kaya ng gamot mo. It's yung dating nagagawa niya because of time and resistance over time to the medication, hindi na pala gumagana. And false sense of security yun. Your glaucoma may be getting worse, but you think by putting those drops without being checked by your doctor that you're okay. It's so important to see your doctor regularly when you have glaucoma.
Okay. So yun, important to note, just because may medication, hindi ibig sabihin na hindi mo na pupuntahan yung doctor mo. This question naman from Ms. Doris talks about if there are no symptoms, what type of eye test. So you already mentioned that it's a comprehensive eye exam that you need to get done. And depending sa resulta na nakikita ng doctor, they may recommend additional tests.
Yeah, and the glaucoma screening package, yes. Depending on the examination. Hindi, as you said, no, as Audrey and I said, it's not all patients. It's patients that have been diagnosed as glaucoma suspects. Kung may nakita nga kaming positive signs na you are at risk for glaucoma, then we do extra testing for glaucoma.
Oo. So, wag mag-alala kapag sinabi nila na magpa-annual check-up tayo. Hindi ibig sabihin nun na screening agad.
Oo.
Check
We
up
will
muna
see
nito.
first whether you're at risk. We won't do it if we don't think you're even at risk for glaucoma. Yeah.
Oo. Ayaw naman natin na parang gagalawin yung mata or mag-check up
Yeah,
ka
or
pa
maraming test
unnecessary.
na hindi naman pala kailangan. Yeah.
Oo. So, yun ang iniiwasan. And then this next question from Zen Vicente. How can you get the pressure of your eyes if you don't have the machine at home, yet you are on prescribed eye drops?
That's why for glaucoma, it's better to still see your doctor. Kasi teleconsult may help because it can tell you, as we said, if it's an emergency that you have to do a face-to-face. But you have to have an eye checkup because that's the only way we can get your pressure and see that you're really doing okay. Although there are home care eye pressures that can be now available, it's not available. It's hard to get them and they're very expensive and it's hard to use. So it's better to see an eye doctor to make sure that your pressures are responding to the medications you're taking.
Siguro, Doc, related to this question, nasisense ko kasi siguro part of why they're asking is when you say drops are meant to lower yung pressure sa mata, kailangan bang na-check araw-araw yung pressure para malaman that the drops are working?
Okay, that's actually a good question. Hindi naman sa araw-araw, but depending on the stage, like what Audrey already has asked me, no, like if it's in the early stage and controlled naman, every 4 to 6 months might be enough. We don't lang naman kasi rin use the pressure alone, no? Yung visual field, yun yung nakikita mo, yung gilid ng paningin. Kaya nga, it's repeated and some patients always complain, why do they have to do that visual field test again? It's because that test tells us that you are not losing any vision from glaucoma. Kasi hindi nga sapat yung pressure lang, kasi hindi nga namin ako na-check yan every day, but those tests, the scan of your optic nerve, your visual field, pag kinumpara yan sa dati mong mga tests na ginawa, dapat pareho lang, hindi lumalala or it's a very stable test. And that tells us, okay yung pasyente. So, hindi lang yung pressure. That's not the only basis to say na kontrolado yung glaucoma. May iba kaming tests to make sure that you are really okay. And those are the other tests that we mentioned.
Okay. Kasi sinabi mo kanina, Doc, na posible namang parang hypertensive lang yung mata mo. So, tumataas yung pressure,
correct,
pero normal yung tests mo.
Yeah,
so,
normal pa yung test na maaari pang i-observe in certain cases, yeah.
Oh, and then you said, Doc, the visual field test in particular, yung mahalaga kasi it tells you exactly what you can see sa buong field of vision.
Yeah.
So, para...
correct, yeah.
Tama ba, Doc? The way I understand kasi yung visual field is that it is literally the universe of what your eyes can see.
Yes, it's just the limit of your as what you can see from the periphery, from the center to the periphery. So ganito, no, Audrey. Remember that the natural course of glaucoma, kung hindi siya kontrolado, is it will affect the entire visual field hanggang mawala. So kung kontrolado yung glaucoma mo, dapat yung dati mong visual field at yung visual field mo na bago, dapat hindi nag-iiba. That means hindi lumalala yung glaucoma mo. Kontrolado siya ng mga gamot mo. That's why those tests are very important to us. Because they tell us na talagang okay ka over the year or over the 6 months kung pinaulit after 6 months. Yeah.
Okay. Yun. So I think that's something good for us to know. And it's, again, a reminder of why you need to get checked. And then the next question is from Jenil Bequilio. What if the patient already has undergone cataract surgery and it was successful, but later on the doctor found out that the optic nerve already has damage? Eventually, vision is not yet regained. Is this curable, Doc?
It's hard kasi for also the doctor probably that did the cataract surgery because it's possible na hindi niya nakita because na nakaharang yung cataract, no? When they did the examination of the optic nerve. So, hindi niya nakita until after na tinanggal na yung cataract na may problema pala yung optic nerve. Unfortunately, if the loss of vision was from glaucoma nga, kasi nga, it's a long-standing problem na hindi lang nakita because the cataract was blocking the view of the doctor, it may not anymore be recoverable. Yeah, you can't anymore get it back. Yeah.
Oo. So siguro that's also a reminder na kapag ang pasyente is cataract yung na-diagnose na sa kanya, hindi necessarily kailangan hintayin na very mature na yung cataract bago siya
Oo.
tanggalin?
Kaya Audrey, it's good that you said na yung as much as possible, no, especially patients that are 40 years old and up, I would encourage you to have an eye exam because this is when problems start to happen, no, in the eye. So at least early on, you would know. Kasi don't assume na any blurring of vision may just be a cataract and naoperahan naman yung cataract eh. You may be
Mm-mm.
wrong eh. That's why it's better to know what you really have in the eye before it happens, yeah. And then if you have a
Oo.
family history, as Audrey mentioned already, kung meron ka ng kamag-anak na nabulag sa glaucoma or has other eye problems, it's better to also consult early kasi you may also be at risk. Yeah.
Okay. So yun. So again, get checked regularly para whether it's a cataract that needs to be addressed or meron palang underlying problem. Pwede kasing unahan, kapag nakita nila they have both, baka unahin muna ma-treat yung glaucoma or vice versa, depende dun sa kaso ng
Correct.
pasyente. And then, Doc, the next question naman is from Zen Vicente. If you have open-angle glaucoma and have cataract, is it safe to delay the cataract operation and manage first the glaucoma?
It is safe naman to delay the cataract surgery kasi cataract naman, basta naman it doesn't reach a level na tumigas na siya ng husto, no? Kasi syempre yung risk rin ng surgery becomes more pag matigas yung cataract. But over the two, you're right, the glaucoma has to be addressed first. You have to control that. And then the cataract later on when your glaucoma is already controlled.
Okay. And then the next question naman, Doc, from Marilu Patron. Is prolonged use of anti-cataract eye drops, say for 2 years, can damage our eyes leading to glaucoma?
Most of the time naman, anti-cataract drops are harmless, no? But we don't actually prescribe anti-cataract drops anymore because there is no medication that can slow down, can stop or remove a cataract. So
Okay.
it's not harmful, it won't help your cataract, so we don't prescribe anti-cataract medications.
Oo. So I guess siguro like yung mga drops kasi kapag sinasabi sa na kapag it sounds too good to be true eh. Kapag sinabi sa bibigyan kita ng eye drops na anti-cataract siya, hindi ka magkakaroon ng cataract. Pero from what we know with cataract, para siyang it's like developing white hair as you age, right, Doc?
Yes, yeah,
So,
you can.
kapag tumatanda,
Yeah, you're right. It's
magkakaroon
part
ka
of
talaga ng white hair. Magkakaroon ka talaga ng cataract. So it's a matter of time and lifestyle, how you live, eat healthy, are you always under the sun? Di ba yun yung mga things that kind of usher in, mas likely kang mag-develop ng cataract na maaga.
That's correct, Pagi.
So yun, ingat na lang po tayo sa mga pinapatak sa mata. Lalo na kapag sinasabi nila or meron silang promise na hindi kayo masyadong sigurado. And check always kapag gumamit kayo ng gamot kung FDA approved siya. Kasi mahirap na, lalo na if it's something you're putting into your eye. The next question naman is from Christina Andrade. What are the possible consequences of having glaucoma? So I think this is something you discussed, Doc, na the worst possible, syempre, is that mabulag ka or magkaroon ng vision loss. But the others is that, habang tumatagal, bumabawas yung nakikita mo.
That's correct, yeah.
And then, Doc, the next question is from Eden Walsh. Good afternoon. I have had LASIK surgery. I'm curious if there is any new findings on preventive measures to avert glaucoma. I'm 62 in good health. LASIK is wonderful, I'm pleased to say. I had it done in 2016.
Okay. Actually, glaucoma naman, the damage. Okay. Kasi sometimes it sounds so worrisome. No? Once you have glaucoma, you're going to get blind. That's the reason why we want to diagnose it at its earliest form, because you can still prevent the damage that it will cause. So if we get you early, usually we are able naman in most cases to preserve the vision you have. So as long as you have a regular checkup, even though if you had LASIK and everything's going well, as I said, if you're 40 years old and up, it's better to have a regular eye exam already, because this is the usual time that glaucoma can start to creep in.
Okay, so yun. Let's get checked regularly. And I'm sure the LASIK doctor in general, sinasabi niya rin yun. Do a yearly checkup. We just want to make sure na yung vision mo is okay, na your eyes are healthy. Okay, the next question is from Henry Javier. I'm diagnosed with 65% glaucoma on my one eye. Do I need to go have surgery?
Now, that's a hard question to answer, no? Kasi you may have like 65%. I'm assuming 65% na lang of ang damage. If it's 65% damage, pero kontrolado naman yung glaucoma ng mga gamot mo or ng laser, it may still just be maintained on medicines and laser as long as kontrolado or nasa tamang presyon, no? But if, let's say, the pressures are not controlled, no? Even though it's early glaucoma or whether it be advanced or early, basta hindi kontrolado ng gamot or ng laser, then you might really have to go for glaucoma surgery. So there are many factors we need to know in the additional information we need to give you a better answer to that question.
Okay. So siguro this particular patient, it might be good to at the very least schedule teleconsultation kasi if you have a copy of your results, the pinaka-recent one, pwede kasing masend siya to teleconsultation.
That's correct.
Pwede siyang ma-refer to ni doc. And they can kind of tell you know what, maybe it's time for you to do an in-clinic checkup. Check natin if you do need to do something else.
Yes, that's correct. Yeah.
Okay. And then, siguro doc, related to this lang, when you say, may percentages ba yung glaucoma? Like when you talk to a patient, what we're seeing is you have 65%. Is it in percentages when we're talking
usually,
about that?
When I explain it to my patient, I may use that, but I usually just categorize them as mild, moderate, and advanced. Or I can tell them how much more is the vision remaining. In the visual field, that will give you an idea how much more of the normal, like if the normal was 100% of the vision, they'll tell you how much more is left. So it's possible he was told na 65% na lang yung natitira, but kung kontrolado naman, we may not yet need the glaucoma surgery. That's why a lot of things have to be known before we can come up with a decision on that case. Yeah.
Okay. And then, sige doc. And then the next question naman from is Selena Obeso. Meron ng findings sa mata ko na angle closure glaucoma, yung right eye, ay operahan ba raw po agad? Kasi po nga, ang nakikita ko sa right eye, may cloud na puti na lang na malabo. Kaya nag-undergo muna ako ng mga eye drops pero waiting sa clearance ko para ma-operahan na po. Okay, so the question is it correct na dapat pang ma-operahan agad ang angle closure glaucoma?
Kung hindi kontrolado ng gamot mo, it may need to be operated on already. Yeah, kasi ang angle closure glaucoma, remember, sarado yung kanal mo. They have to open it either by laser or by surgery. So kung your doctor thinks that it's too late already for laser, that would be the next step, glaucoma surgery. But yun nga, on my part, I will have to see how your optic nerve looks like, kung gano'n naka-damage siya, kung gano'n ka na kasarado talaga sa kanal mo. Maraming factors yeah. So, but yes, it's either kasi laser or surgery that may have to be done pag sarado yung kanal, depending on yung control ng glaucoma mo.
Okay, so it really depends. And siguro sa mga pasyente na ganito, depende na rin sa kanila whether they want a comparison. Like let's say if you want to have a second opinion, possible naman yon if it makes you feel better. Or if you talk to your doctor, it's nararamdaman mo and you find based on yung findings na sinasabi nila na mukhang kailangan na, then it's good to also have a doctor you trust that you can talk to na kapag meron kang worry, pwede mong ma-raise sa doctor. And then the next question naman, Doc, is from V. Valdez. I'm wearing contact lenses for many years. Am I prone to glaucoma?
If you're farsighted or nearsighted, higher risk ng konti. So, it's not because of the usage of contact lens per se. It's more because you're probably wearing it because you have a refractive area that's either nearsighted or farsighted. So it's more because of that. If you're wearing glasses, it would probably still be the same risk. Yeah, it's more of your refractive error.
Oo, so nasa shape ng mata. That's why mas likely ka mag-develop ng glaucoma. So siguro for a patient like this, just get it checked, do your yearly check para at least you know. And then the next question is from Doris Alcantara. Creating a canal to give a passage. If eyes get dry and eye drops, and I use eye drops like Systane, does this have a connection with a blockage in glaucoma?
Again, can I just emphasize lang, Audrey, the blockage in glaucoma, we're talking about an internal canal. This has nothing to do with tears. Tears is an external fluid. So it has nothing to, it's not the water that drains out. No, it's not. The water drains out, but it drains out to the blood vessels. So it's a totally separate pathway. Tears are an external pathway. Glaucoma is more of an internal drainage pathway. So wala siyang kinalaman sa tears or dry eyes. Yeah, it's a totally separate problem. Yeah.
Okay, so that means kapag nagda-dry eye ka, naglalagay ka ng fluid, hindi ka magkaka-glaucoma bigla.
Oo,
Hindi
hindi
tipo
naman siya, yeah, hindi
nagdaan ka
siya
ng
related.
fluid.
Yeah. Oo, ibang
Oo.
pathway yun. Sa labas yun ng mata. Ito, we're talking about something internal eh. Yeah.
Oo. So yun, siguro actually, magandang question to kasi nga baka iniisip ng tao,
Yeah,
kung
I think
ako
it's
nga
a very good
nagpapatak sa
question.
loob,
Buti tinanong
right?
niya yan. Yeah, kasi at least alam, kasi many people think, ay, kaya pala, ay, lumalabas, so okay ako. Wala siguro kong glaucoma kasi nagluluha ako. Pero it's a totally different
Oo.
pathway. Yeah.
Oo, hindi pala yun yun. Sige. And then the next question naman from Mickey de Guzman. How about lifting weights? Does it increase the pressure in the eyes?
It does. It does increase the pressure depending on how much you're carrying, no? So another thing is when you lift it kasi above your head, then the pressure goes to this area, no? So even the eyes can be affected. So if you have glaucoma, you might have to talk to your ophthalmologist about this. Depending kasi on your stage, they may have to give you advice regarding this.
Oo. And siguro with a lot of people who are lifting weights, hindi ka naman siguro immediately from like really light weights into very heavy
Ready to
weights,
go
parang
up, yeah.
progressive din
That's
siya.
correct. Yeah.
So, it's good to, as you're developing, kasi siguro you're working on your body, part of it is you get your eyes checked, you get the rest of your body checked. So your doctor can tell you if it's safe for you to keep doing that, or baka may alternative. Baka body weight exercises instead versus lifting very heavy weights. And next question, Doc, is if you have glaucoma in one eye, what is the possibility of the other eye getting the glaucoma disease?
There's a high possibility because there's a primary and secondary type of glaucoma. No, primary type, it's usually the one that's familial or genetics or nasa lahi natin. So kung yung isa nagkaroon and it's not because of a secondary cause, no, the more often than not, the other eye will follow in time. So yun lang, just have yourself check regularly all the time.
So when it comes to glaucoma, Doc, basta't nag-develop siya in one, hindi siya necessarily parang naghawa yung kabila. It's
Na
because
hindi siya naghawa. That's correct. That's also an important point, Audrey, kasi baka they think it's a contagious disease, but it's more of inherent in the genetic makeup of a patient or yung lahi nga, na sooner or later, because of the genes, no, na medyo mahina yung drainage canal, no, it succumbs to glaucoma, but there's usually one eye that will be ahead of the other eye. Yeah, but yes, it's a high risk that the other eye will follow when one eye has glaucoma.
so even more important for this particular patient to get checked regularly para at least alam natin kung nagsa-start na siya sa kabilang mata. The next question, Doc, is from Fe Alonso. I had closed-angle glaucoma, underwent surgery. Is it possible na mag-close uli yung canal after the surgery?
Good question. Actually, may I just emphasize why that can happen? When you do trabeculectomy or glaucoma surgery, no, so gagawa pinit o tiyak na canal connecting the inside of the eye and the outside so the water can drain in a reservoir in the upper part of the white of the eye. But in glaucoma surgery, it is not 100% success rate. Probably in the best of hands, it's probably 80-85%. Why? Because the body always tries to heal down any canal we make. So, yun ang kalaban natin, yung natural healing ng katawan natin. If it scars it down or magpeklat siya, then sarado na naman yung canal. Then you're back to square one, so you may have to undergo another type of surgery.
So
That's why
kapag ganun, Doc,
yes, go ahead.
it depends on how you heal after
Yes,
the
it depends
surgery.
on how you heal. We do a lot of maneuvers already during glaucoma surgery. Naglalagay kami ng gamot na para hindi magpeklat yung mata. We give extra medications after surgery to ensure na talagang yung healing rate or yung scarring rate ay mababang-mababa. And we do, as I said, other maneuvers like massaging the eye to try to keep that canal from closing. But, nature sometimes takes its course, and no matter in the best of hands, what we do, sometimes the scarring ability of a patient is really so high that it can close up a canal that was working very well in the beginning.
Okay, so it really depends. So siguro in that case, that's where I can see why it's important na you catch the glaucoma early, so you don't get to the point that it's surgery.
That's correct,
as
Audrey.
your
So we don't
earliest
get into
form.
those, that level that you will need surgery already.
Kasi hindi ka sure kung talagang it will be effective for you in the long run.
Yeah.
So ideally,
Yeah.
kung drops, then yes, it's lifelong, but it will still be kind of manageable versus
Yes.
having to
Yeah,
do so many
85,
maneuvers.
yeah. Audrey, 85% naman ang success rate ng glaucoma surgery. And after that, let's say just in case you've done 1 or 2 glaucoma surgeries, trabeculectomies, and the patient still scars down, there are still other options like glaucoma drainage devices na linalagyan ng tube to lessen the risk of scarring. So, may iba naman alternatives kung nangyari yun. Yan pa rin yung first line or second line, but there are other options that can be done to control it kung mangyari yun sa'yo in your glaucoma surgery.
Okay, so I guess the lesson to be learned here, Doc, is get it checked, make sure na kapag nagpa-surgery ka, puntahan mo yung follow-up checkup para at least the doctor
correct.
can tell you
Oo.
na sige, we're healing okay, looks like there's no other issues.
That's correct, Audrey.
And I think, Doc, siguro another thing is you said na you also provide them with medication after the surgeries to make sure that
That's
the
correct.
healing progresses well.
Yes.
So, kapag sinabi ni Doc after your surgery, magpatak ka ng gamot, you do it, you follow it. Don't
Yeah, you have to
assume
do it.
because you're seeing
Yeah, to the letter, yeah.
okay na. Kasi sayang, nagpa-surgery ka na eh. It's a matter
Oo,
of making sure.
Yeah, it's important to stress, Audrey, 50% of the success rate of glaucoma surgery, yung trabeculectomy, is your follow-up. Kasi doon namin ginagawa lahat ng mga maneuvers or medications or extra parang added treatment to ensure that that canal we made during surgery remains open or to try to
Okay.
get it to stay open.
Okay, sige. So that's, I think we actually were able to cover so many questions today and a lot of information about glaucoma. For those people that still want to continue asking us some questions, you can still do so in the comment box. You can also send us a message through Facebook, of course. If you want to set an appointment, it's also very much possible. But for you, Doc, siguro, do you have any last advice to the Facebook Live viewers?
No, yun lang naman. Try to, if you have glaucoma, I know it's the pandemic, and we are all scared to go out. But remember, if you are in the advanced stage or moderate to advanced stage of glaucoma, you have to see your doctor. There's no other way for us to make sure that you are doing okay. Kung talagang hindi kaya, at least a teleconsult so we can advise you what to do just in case we think that you are not controlled with your medications. Yeah, yun lang. It's, as Audrey has already said it, it's better to get glaucoma at its early stage or to detect it at its earliest form so we don't reach the stage na naapektuhan na yung paningin. Remember, once you're diagnosed with glaucoma, don't feel depressed. No? If you're diagnosed in the early stage, that's actually good. We can do a lot to protect you for the future as long as we are able to detect this disease in its earliest form.
Okay. And then, when it comes to the protocol siguro that we have in the clinics, for those people that, let's say, they do a teleconsult and they're told, sige, come in na, let's do a glaucoma screening para sigurado tayo. The good thing with the protocols we have in place is that syempre very stringent siya. So kapag nagpa-appointment ka, may health declaration din yon. We check your temperature, limitado yung mga tao that can enter the clinic at any one time.
That's correct.
And you can only, of course, you only bring one companion. We cannot have too many people para makapag-social distance tayo. And then, if you have concerns siguro sa mata already, you're already kind of feeling something, important then, like, list down some of your questions. Siguro sa mga pasyente, gusto natin in and out. Pagkapasok, check up ng mabilis.
Yeah, that's a good suggestion, Audrey. At least parang everything is asked. Like at least they don't have to stay too long also, yeah. If they ask all the questions already.
So, it's good. I've seen some people do this. Kunyari, naisip na nila yung tanong, they actually tell their companion, sige, remind mo ako, itanong ko kay doctor to, or they put the questions in their phone. Para even, kasi kapag nilista mo, sometimes, Doc, you forget your list eh.
That's correct,
So, you might as well put it in the notes section of your phone or i-text mo sa sarili mo. And then siguro, Doc, if say they wanted to set an appointment with you, ano yung clinic schedule niyo?
I'm in Asian Eye, Rockwell on Monday, Tuesday, and Fridays, and in Trinoma on Saturdays and Thursdays in Asian Eye, Alabang.
Okay, so yun, there's a lot of options whether you're living within Makati or somewhere in the north or the south. So at least Doctor is very accessible to patients. And then thank you again, Doc, for such an interesting discussion. We learned a lot about what glaucoma is. And personally, I thought it's good to know that there are so many treatment options. So hindi ka, yes, it's a sneak thief of sight. Magnanakaw siya talaga ng paningin. Pero meron tayong ways to either manage it or to stop it from becoming to a moderate degree or an advanced degree na of glaucoma. So if you want to get your eyes checked at our clinic, please give us a call or send us a message through any of our social media accounts. We're on Facebook, we're on Twitter, we're on Instagram. You can even go to our website and just key in your information and we can give you a call to set your appointment. And again, if you have additional questions, just message us. We'll be happy to answer your questions. And for those that want to try our teleconsultation, you can just set an appointment by texting or calling our teleconsultation hotline. So that's at 8898-2020 or 0917-800-9103. Or on the upside, another good thing is that we also have a way for you to be able to get any new eyewear or to replenish your eye meds. So let's say pasyente ka na doktora and she tells you that you need to buy medication regularly. You can actually buy it online and have it delivered. We deliver it nationwide. So you can do it conveniently and safely by visiting www.asianeyeshop.com. You can get frames for your kids or for yourself, sunglasses, contact lenses, sports eyewear, PPE. So let's say you need goggles or face shields, and even accessories like lens wipes or eyeglass cords. And yes, if you do need to have prescription medication, you can just submit your prescription to us. Or let's say nagpa-prescription ka kay doktora, you can submit that same prescription and we'll be able to deliver your medication for you. And we also have siguro a lot of things that we have in store for people. We have the Perfect Pairings promo still ongoing. You can get 15% off if you get 2 frames. So we have the Daily Specs brand available. You order that online, you get 15% discount. You can also have an upgrade to UV plus blue light lenses for your Daily Specs or Kid Specs frame. So kailangan mo nakasalamin na. It's time. You're doing work from home. You might as well upgrade your lenses. So whether you're working on your computer a lot or naarawan ka madalas going to your office, you have protection. We also have contact lens and solutions for as low as 1,039, as well as frame plus Zeiss lens wipes for as low as 2,090. And of course, avail of our electronic gift checks. You can get the Asian Eye Family Eye Care Package. So that's perfect for a family of 4 for only 5,840. So 4 people get a checkup. You don't have to worry so much about it. And then if you want to do a teleconsultation, we have an ongoing promo that you can get it for only 400 pesos. And of course, one more thing that is still available is our LASIK buddy package. So I think there's a patient that was talking about getting LASIK screening. It was wonderful. If you're thinking about getting that for yourself, or maybe you have a friend that wants also, get the gift check. It's only for 3,150. Dalawa na kayo makakapag LASIK screening. So remember that Asian Eye Shop ships nationwide, and it's free delivery for purchases of over 2,000 pesos. So again, www.asianeyeshop.com. You can access the experts at your fingertips, and you can even set a teleconsultation with Doctora on the same website. So again, thank you so much, Doc, for spending your afternoon with us.
Thank you, Audrey.
And thank you also for our Facebook Live viewers. Let's all take care of our eye health, and we will see you at our next Ask Your Asian Eye Doctor Facebook Live Q&A. So please continue to stay safe, everyone.